All right. Well, good afternoon, everyone. Thank you so much for joining us here for our event titled The Physician and Voting. My name is Ali Bukhari. I am the president of the American Medical Student Association, and I'm very excited to be here with you at this event where we're joined by some incredible speakers from different organizations, including Vote Health, Vote ER, Patient Voting, and Community Health Vote, where we'll be discussing civic engagement, especially amongst the healthcare community for our patients, for students, for healthcare professionals, and more broadly for our general communities. As we know, this is an incredibly important election, and there's so many different efforts that have been going on. So we'd love to just dive right into our discussion here and talk about all the different efforts and what we can do with less than a month left between Election Day to increase the level of civic engagement and participation in the country through our roles as healthcare professionals, as physicians, as healthcare professional students, and then also what types of efforts would be required even after this election is over to be continuing the efforts to increase civic engagement. With that, I will turn it over to our moderator this evening. We have John, who is currently serving as a Med Out the Vote co-chair, and Med Out the Vote is a campaign whose mission is exactly aligned to increase civic engagement, beginning as early as medical school and extending through residency amongst physicians and for patients after that. So we'll kick this over to John, who will go ahead and introduce our speakers here.
Excellent. Thank you, Ali. So here today we have 4 wonderful Get Out the Vote groups that are working at the interface of voter enfranchisement and healthcare. We have Mark Weatherhorn here from Community Health Vote. Katie Berry is from Patient Voting. We have Alistair Martin from Vote ER and Saranya Lehrer from Vote Health. So I think our first question, just to kick things off, is to provide a sense of an overview of your organization and where you see yourself in this large ecosystem of healthcare-based nonpartisan voter registration. This is a space that we will flesh out through the session, so don't feel like you have to, with this single answer, provide an overview of everything. But Mark, could we start with you and tell us what Community Health Vote is up to? And then in this larger, again, ecosystem, where do you all kind of fit?
Well, Community Health Vote is actually sort of an umbrella for a whole range of civic engagement efforts that federally qualified health centers have been engaging in really since 2010. And the goal is federally qualified health centers obviously care for the uninsured low-income patients. And the goal was always to try to engage these folks, not just in registering to vote, but in actually participating in elections and in advocacy. And so it's about getting community health centers the resources and the experience to be able to engage their patients in a way that fits in to the work they're already doing. Many health centers, and in fact, anybody who is enrolling somebody in Medicaid or in any other sort of program, food stamps, WIC is required to offer voter registration under the Motor Voter Act. So there's already that infrastructure in many places, but it's separate from the health center to a large degree. So our goal is just to see how many folks we can get engaged through the health centers around the country. And like I said, we started in 2010, and Community Health Vote has kind of faded in and out, but I still do this work with health centers all over the country.
Wonderful, wonderful. So we have one perspective from community health centers. Katie, could you give us a sense of what patient voting is up to and where you all are based?
Yeah, definitely. So thank you so much for having me. Patient voting was founded in 2018 during the midterm elections by Kelly Wong, who's an emergency medicine resident at Rhode Island Hospital. She realized that patients who were in the ER or admitted to the hospital in the week or so before the election didn't know that they could vote and were often worried about it. So she wanted to find ways that doctors, volunteers, medical students could provide information to patients about how they could still vote even if they were hospitalized around the time of the election. So the mechanism already existed. So a lot of people know about absentee ballots for college students or people in the military, things like that. But a lot of people don't know about emergency absentee ballots. So that is for registered voters who thought they were going to be able to vote in person didn't request a mail-in ballot because they planned to go to their polling place, but then weren't able to for some reason, including being hospitalized. So in most states, that means when you're in the hospital or wherever you are when something happens to you that you can no longer go vote, you have to get an application form, fill it out, explain the reason that you're not able to vote in person anymore. And it varies state to state what counts as a reasonable excuse for that. But all of that information are things that we have tried to get into one location. It's kind of the point of patient voting. And then somebody would have to take your application and bring it to your board of elections. They'd give you your ballot, you'd fill out your ballot, and someone would have to bring it back for you. So obviously that can be really challenging if someone's in the hospital, even if they know the process. So in addition to having one centralized location for all of that information, patient voting has tried to create national volunteer bases of people who, if it's allowed by that state, can be that kind of courier of the ballot and the application if needed. So we're kind of a different niche than the other organizations. I think a lot of the other organizations are helping people register to vote or getting doctors and medical students to vote. So our niche is really getting patients to vote who are already registered and couldn't for some reason at the last minute.
Wonderful. So we went from health centers to kind of inpatient wards. Alistair, could you go next and get us a sense of VoteER, where you began and kind of where you've had to pivot?
And pivot we did, didn't we, John? My name's Alistair. I'm an ER doc. I work up here at Mass General Hospital. And first of all, let me say that, this is such an inspiration to be on a panel devoted to healthcare-based civic engagement. I mean, it is time that healthcare providers, healthcare institutions used the privilege that we have, the opportunities that we have to empower our patients to have their voices heard. And I hope to see the proliferation of this field and the entry of as many organizations as we can. We've got 4 really great organizations here. Let's 10x that over the course of the next couple of years and really build this space out. VoteER's story is very simple. I noticed probably from the outset of emergency medicine residency that the same patients who were on the margins of our healthcare system, the folks who are coming to the ER for primary care, who have to go to community health centers, or have to go to free care clinics to get care, those patients, demographically speaking, are the same exact patients who are not registered to vote in this country, 50 million plus. They're young people, they're low-income Americans, and they're Americans of color. And the idea was fairly straightforward. Back in September of last year, we began piloting an intervention at Mass General Hospital, which is how can we offer these folks a way to register to vote while they're waiting there in a way that's nonpartisan, non-interruptive, non-coercive. And the work of VoteER started initially with kiosks. We partnered with institutions across the country. And then we've gotten up to about 25 hospitals who have deployed one of these kiosks, one of these posters that you can see behind me, or the discharge paperwork that would go out when folks were discharged from the hospital. And then COVID hit. And we had to think fast, think on our toes, and really incredible team, folks like John and many, many others contributed to our pivot, which is the healthy. Oh,
You all right?
I'm okay. I don't. But if I did.
You're demonstrating the pivot, Alistair, and then COVID.
Yeah, exactly, the most massive pivot.
But if
pivot
I did,
bam, take it away.
I would, at the ER, be able to register to vote using one of these Healthy Democracy kits, which we have 25,000 now across the country. If you order one, they're free. Comes in a box like this. And when you get it, it basically, when you open it, you get a lanyard like this and a badge backer like you've seen. And in summary, these 25,000 Healthy Democracy kits have turned into about 40,000 people who have registered to vote, gotten mail-in ballots. And we're lucky enough to have the infrastructure to continue this on until 2024, at least, we hope, and beyond. So that's a little bit about us. I'm going to go do a real quick concussion screen. Make sure that I can still stay on the rest of this.
We hope you're safe. So wonderful overview from community centers into tertiary care centers into the ED, which is the interface of this. So Rania, can you give us a sense of the great work that Vote Health has been doing and how you additionally fit into this picture?
Sure. Well, it's a privilege to be on with all of you partners, collaborators, heroes. So Vote Health 2020 we started in early 2020, and we have 3 primary objectives. The first is to make sure and let me just say, we are a nonpartisan coalition of health professionals and sort of health professionals more broadly. And we have 3 objectives. The first objective is to make sure as many people as possible that are eligible to vote can vote, and that they can do so as safely as possible. The second is to really be cultivators of a broader community of health professionals who are interested in this common purpose and goal. And third is that together in collaboration, we are all contributing to a movement of people who deeply understand the connection between civic engagement and health outcomes and want to work together to create a more just and equitable society. And, you know, part of the impetus for us being developed was we saw, as many of you have seen time and time again, the number of people who actually register to vote, people who are eligible to vote, but don't vote. And we know that even pre-COVID, healthcare was often the #1 issue on voters' minds. And yet, and I know this data is old, but physicians don't tend to vote as often as the general population, which already didn't have, I would say, an ideal voting turnout record. We also know for other reasons, voter suppression, systemic racism, and other policies and practices, certain communities, it is also harder for them to vote. And this was even pre-COVID. And as we've seen through COVID, as we've seen, I think in particular, after the murder of George Floyd and others, I think there's a real awakening amongst us in healthcare, but also more broadly, of how important every election is. Not just the federal election, but local and state elections. Whether your town has a mask mandate, which mine in New Hampshire does not, what's going on with the school board and ensuring, you know, kids are safe at school, who are your local sheriffs, who are your local prosecutors. So I really do think we're at kind of a pivotal moment in this country, and also for healthcare and healthcare providers to be thinking about the role that we can play, which is an enormously powerful one.
Wonderful, wonderful. I think, so both of you or all of you are really getting at this issue, but perhaps we can clarify, is voting a dimension of healthcare? Is voter enfranchisement a dimension of healthcare? And can we begin as a group to build the case for this? So suppose I'm a physician who's on the borderline and a little uncomfortable with this work. How would you cogently describe, and we can give kind of each individual a turn because it's multi-dimensional, what is one reason why we could justifiably see this as a part of our professional responsibility as a dimension of healthcare?
Well, I would say the reason we get health centers involved in it is because it's very clear that civic engagement is one of the social determinants of health. Obviously, being civically engaged, people are healthier. That's what the data shows. And so the question becomes, if your mission is, you know, not to register people to vote, but to help people be healthier, then this is one element of it. And so I think that's one way we justify doing this as health centers, because it's part of their mission. They came out of the civil rights movement. They started out that way. So it hasn't been that difficult to sell just to talk about, you know, voter engagement. So I'll let other people talk, but I think that's the perspective we use at health centers.
I think, Mark, almost every organization, healthcare organization, at least purports, states that they care deeply about health and the health of their patients, and increasingly in the past several years, the health of communities. And so I think, so if an organization really does believe and commit to in their mission, vision, and values, the health of populations, And if we believe, which we do, that, and what we know from the literature and from the research, that civic engagement is a contributor to health outcomes, then engaging in things like voter participation, which is a mechanism of the social determinants, or as Don Berwick would call it, the moral determinants of health, makes a lot of sense. I think there is also this, it's an opportunity for us to really to see if there's a disconnect. I often call it, between prose and practice. So what do we say? What is on our mission statement? What is on our walls when we walk in? And how do the policies and actions and behaviors of our institutions and our leaders reflect that? And I think civic engagement, civic participation is a really important component of that. The census is another, civic engagement effort that directly impacts the work of health systems. And the last sort of component that I'll mention, and I can also put it in the chat if people are interested, many of you may be familiar with the concept of anchor institutions. And I'll just say it for those that might be less familiar. It was really informative. It was a concept developed by the Democracy Collaborative. And they talk about anchor institutions as organizations that are really embedded in communities. They're not businesses that might come and go. And the most common examples of anchor institutions are hospitals and universities. They are deeply embedded in and entrenched in communities. And therefore, the Democracy Collaborative sort of proposes, and there's a number of health systems that are, I think, increasingly buying into this notion that their responsibility and obligation to the community is then different, and how they show up as purchasers, as investors, as employers in a community matters. And there's a special obligation for those systems in those spaces. And I think we're starting to see that more and more, which makes civic engagement and participation and encouraging not just their patients, but their staff and their communities to engage all the more important.
Wonderful. Wonderful. And Alistair, you were mentioning the demographic overlap. Could you give us another picture on that?
Yeah, absolutely. First, I'm happy to report that I passed my concussion screen. And so I am fully engaged here. I'll tell you a quick story. This is maybe 6 or 7 months ago now. I remember I had a patient who came into the ER. She was in her early 20s, a Latinx woman. And she had diabetes. She had type 1 diabetes. And I remember looking at her chief complaint, and her chief complaint on the EMR was DKA, or diabetic ketoacidosis, which is, for many of the viewers, you already know this, but for some who don't, a very, very rare complication of diabetes. And it only happens when you don't take your insulin, or you have other types of triggers that knock you into DKA. And so I remember a group of us that were doing the rounds. There's a couple residents, I was the attending on, some nurses, and we were looking at her chart. We realized that this woman had already been in the ER for DKA 5 days before that visit. It's very rare to get DKA once in a week. She had it twice. I remember the first thing that came to all of our minds was, what's going on with her? Why isn't she taking her insulin? Why is she non-compliant? We went to start rounds, and I decided to take a step away, and I said, no, there's something I'm missing. Let me go talk to her and figure out what's going on. So I went and I asked her, what's up? Like, it sounds like there's some issues with your insulin, and it looks like you're in DKA again. We're gonna do the best we can to help you. We're gonna make you feel better. But what's going on? Why aren't you taking your insulin? I said, doctor, it's not that I'm not taking it. It's that I lost my job recently, and I don't have health insurance, and I've been having to pay for my own insulin. So I've been rationing it and not taking it. And guys, the sort of feeling that I had in that moment was, I had this sort of deep sort of pit in my stomach. I didn't know what to say. And, of course we helped her. We got her out of DK, we admitted her. But look, I can't solve her problem with a surgery. I can't solve her problem with a nerve block or a prescription. She can solve her problem by voting. We can solve her problem by voting. And for too long, the impact of discrimination, of racial injustice in this country, of redlining, all of these things add up to create this vortex of circumstances that impact the social determinants of health for our most vulnerable patients. And when did we see that most clearly? With COVID. Look at all around this country who died the most disproportionately in all the big cities. Who did I put on ventilators for COVID more than sort of is our average, Black and brown people, poor people. And so I think COVID made clear for us in a way that was really not clear previous, or to many folks, it was easy to overlook. COVID made clear the connection between civic engagement and healthcare, and now it's up to us to do something about it. And the good news is we've got a lot of folks on this call who are helping patients vote like their health depends on it.
That's powerful, thank you. Katie, this next question may be difficult to get a sense of, but can you give us all first a sense of where you're based and what you feel in your region, or at whatever level you'd like to discuss, the support or resistance to healthcare-sponsored voter enfranchisement is? Are people uptaking this? Is it just kind of at the student level? Is leadership involved? Any number of this.
Sure. Yeah. Oh, sorry. My dog is barking. So yeah, we're based in Providence, Rhode Island. I, first of all, just want to say that I completely agree with everything you all just said. And I think as physicians, medical students, health professionals in general, as well as healthcare administrators and people who are making these kinds of decisions about whether or not we can be involved in this kind of work, we should be concerned with our patients' health outside of medical care, as especially Alistair was saying, like, we know there are so many things outside of the medical care we provide them that changes how effective our medical care is. We can't help someone with diabetes if there are factors in their life that are preventing them from taking the medication we give them or understanding the information we're providing them. And so if it's not enough to just care about our patients, that we want to make their lives better in other ways than medical care, we know that it makes it easier for us to give them effective medical care if those things are taken care of. And voting and civic engagement are one of those kind of social determinants of health that we should be focusing on. Another thing I wanted to just mention briefly was that in addition to those more theoretical things, we have documented evidence that, especially like the work that we do, patients don't want to come to the emergency room no matter how sick they are in the days before the election, because they want to vote. So for people who already know that voting is important, it's something they really take pride in. No matter how sick they are, they're going to put off going to the emergency room as long as possible. And that's obviously not something we want. That's going to lead to worse health outcomes. They're going to be sicker when they get to us, and they're going to have a worse course in the hospital. So that's another motivation for the things that we do. Like we know that we have seen that problem. We hear that people don't want to come to the emergency room. So we want to make sure that we're giving people the best medical care by making sure that they can access that medical care. In regards to what you were asking about how this is received, so I'm a medical student. My classmate and I coordinate the medical student involvement in patient voting. And I think among my generation, this is really clear. I think everybody really understands that we need to pay attention to a lot more than just someone's A1C if we're gonna manage their diabetes appropriately. I think there is some resistance. I think physicians in general are pretty receptive. I've come across some who aren't. But I think the biggest problem is with the hospital administrators who put up a lot of barriers to anything that might seem political. Even though we're all nonpartisan, we're not concerned with who you're voting for. We just want to empower you to have your voice heard, especially if you're from a community that is less likely to have their voices heard. There is some resistance, but we've actually seen throughout the country, the medical student coalitions that I've been working with have had a lot of success in asking their physician mentors, their hospital administrations, to kind of get this out into the community, but there has been some resistance of people not wanting to seem political.
Wonderful. Mark, can you give us a sense of, in the work that you all do, it sounds like people are pretty bought in. Do you have a sense of the difference between hospitals and health centers and why this may be disaligned?
Well, yeah, there's a significant difference between hospitals and health centers, and that both in terms of funding and in terms of the operational, in terms of location. And again, there are all kinds of hospitals, right? There are private hospitals, there's the Cleveland Clinic, and then there's Grady Hospital in Atlanta. Health centers, generally, are more similar than dissimilar, although they're different sizes. And I think in part, it's a little bit what Katie just said, is that it really depends on the leadership, right? I mean, the leadership's bought in, and again, the health center movement started as part of the civil rights movement. There's a generation of health center leaders who grew up understanding this as part of their operational activity. That it's not necessarily as true as more business-like people have taken over health centers, but generally, yes, people understand the need. But I would say one thing, and I'll say this now as opposed to later. I've probably been doing this longer than some of you have been alive. And so the issue really comes down to, it's great to register people to vote. It's great to get them to vote in 2020. But if you go away after that, then you've lost whatever momentum you have built. If there's not an infrastructure so these people can be educated, it's fine to tell them that, they can't get insulin, but what's the solution to getting insulin? And voting is not sufficient, right? And we saw that when the ACA passed, and 2 years later, people didn't vote, and nothing, basically it has been under attack ever since. So I really want to emphasize the fact that, yes, people need to vote. Elections do matter. But a lot of times on November the 5th, not just the organizations, but the funders are done with the activity. And so I think as you think about this, it's how do you institutionalize the whole range of civic engagement, not just the voting piece. So
that's wonderful. I definitely want to put a pin in that and return to it. Saranya, can you give us a sense of whether people are signing on to this, where you are based, or whether there's been resistance that you've encountered and how you've confronted that?
Sure. And so I'll just also make a caveat that my day job, what is a day anymore, a year, a month, but in theory, my day job is I work at the head of innovation at the Institute for Healthcare Improvement, which is based in Boston. So I spend the majority of my day job time talking to health system leaders. So it's been an interesting or collaborating with them. So it's been an interesting sort of approach. I think that, so we work with a number of different sorts of folks all across the country. So anywhere from health system CEOs to, tenured professors or chairs, and medical students, hospitalists, undergrads. So we work with a lot of different types of health professionals. And I think that the response is in a couple of ways. So the first is, I think there are places like Mark is describing, FQHCs and community health centers, that this is embedded in who they are and what they value and what they believe and how they show up for communities every day. So there's lots of community health centers like that I think are the most progressive and committed around civic engagement. In terms of health systems, I think it is mixed, as Katie was describing and as Mark described. And I think it's mixed and I see three sort of primary opportunities. So one is simply around education. Mark described many times people say, oh no, we're not allowed to do voter registration. And in fact, not only are you not allowed, in some instances, and as Mark was describing, you are encouraged to help people vote. That's, VoteER, American Hospital Association, Patient Voting, Vote Health. We've all got a lot of great tools and resources to help people understand the actual legal implications. It's a little bit like HIPAA. I ran an experiment once where we just asked people, if you could break any rule you wanted, what would it be? And there were so many different ones related to HIPAA. And so then we just called the folks at HIPAA up and said, here's all the things that people say suck about HIPAA. Can you go through and actually tell us whether those are true or not? And the vast majority of them were not, they were misinterpretations of a law or a ruling. So I think there's a lot of opportunity to educate folks around what is and is not possible, not only possible, but encouraged. I think the second thing I would say is a little bit of advocacy where it's appropriate and where you have folks that might be champions of this work. Hospitals spend a lot of money on lobbying, a lot of money on lobbying. And so who decides what's on those agendas and how much money is spent lobbying around policies and practices? I think that's an important and sort of interesting conversation to have with leaders. And again, it maybe depends on who the leaders are and who's having those conversations, but I do think there's an opportunity to shift mindsets and perspectives around advocacy. And then the third component I will say is about community. So the fact that you have all of these examples all across the country of people starting to do this work matters. It all matters. Even if 100 hospitals that we went to said no, a seed was planted, a movement was started, people are thinking about this, and the next time, and the next time, and the next time, it all matters. We also have people who've gotten, oh, you got that question? I actually know the answer to that question now. You know, I can help you sort of like, we can talk to each other and we can help each other troubleshoot some of those challenges. We can ask the government relations or the legal officer at one hospital to call their counterpart elsewhere. We can elevate and celebrate and amplify this work. And then it becomes less scary or feeling alone or feeling like, oh, I think a lot of the hesitation is I'm stepping out on a ledge here to do this. And in this environment, that feels really scary. I think everything that all of us are doing, and Mark, you have been doing, is chipping away at that fear and that concern and actually turning it into a much more of a norm. We are nowhere near there, but I do think that all of this work is really helping to do that.
Wonderful, wonderful. Alistair, if you could also briefly speak to the Boston scene without spilling too much tea at your hospital, support or resistance. But then also, I feel like we are all grasping towards a larger question here. This movement is so complex. Our country is so heterogeneous. Healthcare as an industry is extremely different in its systems, care patterns, and so forth. What does a roadmap look like for institutionalizing nonpartisan voter enfranchisement in healthcare in the United States? Is there a discernible pathway that we all can begin to sketch out from pre-registration through registration and so forth? What are those steps along the way? And then maybe can we think about how organizations fit into those? But before we go there, Alistair, could you give us a quick sense of MGH and then begin to lead us there?
Yeah, it's a really good question, John. Look, my story at MGH is effectively the same story. I think that most of the folks who work with VoteER and probably folks who work with Vote Health and patient voting and the many other organizations that are doing this good work of healthcare-based voter registration have experienced, and that is that it's not completely frictionless. There are folks who have valid concerns and valid questions around how to do this in a way that doesn't interrupt care, which is valid. The primary concern, the primary priority that I have when I go to the hospital is to take care of patients. And that's the first priority. Or other concerns like, how do we do this in a nonpartisan way, which is totally valid given the C3 implications. And then, lastly, I think the third, hurdle that we had to, address here was how do we do this in a way that is inclusive, but not overbearing, is not sort of trying to leverage the authority and power that healthcare providers and hospitals have to, bully patients or insinuate that your care in some way depends on voter registration. So, hey, look, these are all valid concerns that even before we launched the first kiosk in September back in 2019 in Mass General, there was a year-long process of trying to make sure that we were listening to our CEO, make sure that we were listening to the chair of our department, and really getting as much feedback as possible, because we knew that if we could solve for Mass General, we could probably solve for some of these other hyper academic institutions that have, extremely long IRB processes. Along the way, we had to even make sure that, we got IRB approval to do it, which was another sort of proof, an imprimatur, so to speak, that this was an okay thing to proceed with. So, so that was my experience at Mass General, a long process of listening and making sure that we were hearing the concerns and figuring out how to make it, how to make a system that responded to those concerns. To your second question, I think you're exactly right, John. I think, there is absolutely a need for, folks in this space to coordinate, figure out which are the key intervention points, the intervention moments, and sort of the ability to really master that domain, and then hand off, right? So, I would even start a step before the registration process. I think there's an opportunity to communicate to patients, why does voting matter? Why is it important to get involved in civic engagement? I had a patient a couple of weeks ago who was in her early 20s, and she asked me about my lanyard, and I said, yeah, if you're interested, you could register to vote. She said, why would I vote? Why would I vote? It's not for me. And so I don't have time as an ER doctor to sit and describe to someone why it's important to vote all the time. Sometimes I do, but I think it starts even before that. Then there's another space, which I think you're totally right, John, around registration. There's another space after that, which is all around sort of like, once people are registered, how do you educate them about the issues so that they can, sort of vote in an informed way? After that, I think there's a get out the vote piece of it, which is around cultivating civic muscle, cultivating the ability to get people out and to, get people, either voting, in a routine and regular fashion, making sure that's part of what they do. And then lastly, I think that there's a real piece around this. It's around community organizing, quite frankly. We have, over the course of the last, 6 or 7 months now, got about 305 hospital systems that are using VoteER, 25,000 healthcare providers. We're not doing the type of community organizing that I think we could be doing, which is, how do you change the doctors? How do you make the doctors community organizers? How do you have them go out and do what Mark was saying, which is, helping folks in the community really solve their own problems and not just mobilizing, right? So we're beginning to instill some of that in some of the work we're doing with our community organizing team that we have. But I think there's a ton more that we could be doing, and this space needs all the help it can get, and as many folks who are committed to doing this work as possible. So.
Wonderful. Mark, I wonder if we could turn to you next, recognizing that a lot of the FQHCs are on the vanguard, are the point of the spear. Building off of that framework of kind of pre-registration, registration, electorate education, up through voting, what has been your experience in that pathway? What learnings can we take from FQHCs and maybe take to academic medical centers or tertiary centers? How can academic centers and other tertiary centers contribute to, rather than be the bulwark against this change?
Well, I would say the first lesson, and that we always worked on with health centers, is focus on your staff first. If your staff isn't convinced that this is important, then they're not going to do it. And if they do it, they're not going to do it well, right? So I believe if you surveyed the staff of these institutions, you would find a significant number of non-voters and non-registered voters. So I'd start there, right? I think, and second is that voter engagement grew out of the advocacy work we already did with our patients at health centers. In other words, we already recruited our patients as advocates and tried to educate them about the issues that impacted them in the health centers and their communities. So you weren't starting from scratch. And even then it's very difficult, but if you don't do those two things first, I think you shouldn't expect to be successful with patients. Those are the first two things I would say. Then I would say you need to have reasonable expectations that the vast majority of the patients you see at health centers, low income, uninsured, we have patients at health centers on the border in Texas who are who are illiterate in 2 languages, right? So registering them to vote is not an easy thing to do, and staff doesn't always have time to do it. So you have to have reasonable expectations, but it needs to be ongoing. If you're just registering voters, I know people say people only focused on the elections, 2 months before the election. But if they see posters year round, you can register to vote here. Voting is important. Ask us about registering to vote. Then people don't walk into a place and go, well, wait a minute, I came here for healthcare. What is this about voting? So, and lastly, I'm not a physician, but, health centers and hospitals and providers, have been really good at sort of smoking cessation and diabetes and these other things. Well, this is not that different, right? You didn't just put out a piece of paper and say, stop smoking. You have a whole program to help people stop smoking. So you have to have a whole program to help people be engaged and to understand why this matters. And yes, we've registered people at health centers. I've tried to register people at health centers, and the response has been, it means nothing to me. None of these people care about me. I'm not going to make any difference, right? Well, nobody I know has time to have that discussion with a patient in the waiting room of a health center, right? So the first thing is grab the low-hanging fruit. The people that want to be registered to vote, the people that want to vote, the people that care already, make sure they're registered, right? And then use them to reach out to the community and work with other folks. But I think it's a mistake to think that technology or good intentions are going to make a huge difference in this process without building that infrastructure to do the work.
Wonderful. Extremely insightful. Saranya, this will be the last question I'll ask before opening up to a larger Q&A. But with your experience at the IHI and talking with health systems at all levels, what is your guidance on how to build coalition amongst the 4 groups here, the hopefully 40 groups in the future? How do we take a unified step forward in this movement rather than splinter into, I don't know, silos or just regionalization, or you get the sense.
I do. I think the magnitude of the challenge is enormous, and so the solution has to meet that. We got to meet the moment with what it requires, which is everyone. So one of the things about movement building is it can't be one person, one man, one method. It can't be that. It is about people seeing themselves in this work. Each one of us saw something. We saw an opportunity and we saw a way to serve. And so we did. And in that, other people started seeing themselves in that work, which is why they started coming together. One of the things that has been most joyful, truly, about Vote Health has been seeing people I have this idea, here's something that you haven't thought of yet. I have this idea. Can we try this? And so I do think that it's not about trying to corral everybody into here's exactly what you do and how you do it and when you do it. I think each of our organizations actually plays a really important role. And I think one of the things that you all have done at AMSA, which is critical, is you're bringing us together. It is about sharing and learning and celebrating and improving together. And that's just not with the 4 organizations on this call, including AMSA. You keep mentioning 4, but you also lead the AMSA initiative and met out the vote. So there's 5 big initiatives here that you need to also celebrate and acknowledge the great work that Met Out the Vote is doing. So it's our collaborations, it's also our partnerships with others as well. So part of what Mark is saying, and I think Alistair alluded to this as well, is it's not always possible in a patient-provider interaction to be having these conversations. It also, in states, the legislation is changing or processes are changing. So you need different people with different talents, different assets, different backgrounds. We need us to all be doing this together. Otherwise, I think Mark is spot on in terms of the magnitude of the challenge ahead of us, which I have all the confidence that we can meet. let's meet it in a way that, you know, we bring our values, we bring our assets to it in service of a common goal, but it may not be common methods or common, you know, sort of mechanisms to get there.
Beautiful, beautiful. I definitely invite others to ask questions. I think this is a great time. We have some real experts in the field here. And so whoever wants to ask, feel free to unmute yourself and go for it.
Sure, I guess I can kick things off here. Thank you everyone for this incredible discussion. As I was hearing this, I was just thinking about how I would love to just continue talking about all these ideas and think about how we can increase on the work for to go on even beyond the election. So many of the things that you talked about here are things that, you know, resonate with like-minded people like us. And I was thinking about some of the concepts mentioned. You know, Alistair, you were talking about having physicians or health professionals as community organizers, or Mark, you were mentioning the need for the infrastructure to be in place that will take advantage of the tools. Do you have any thoughts about how we can invest in that infrastructure, make it grow, or to create community organizers out of more health professionals? You know, is it at the training level? Is it amongst at the school level for students as they're becoming trained to become physicians, and nurses, PAs, or any other health profession? And what would it take to be able to start shifting, I guess, essentially the role of physicians and health professionals, so that we can not just increase civic engagement, but improve health more broadly?
I can start us off on that. It's a great question, Ali. You know, our example is just one, and I'll end with sort of where I started at the beginning. That we have let's consider it 5 with men out the vote, 5 groups here. We need 10. We need 10 times more. We need to have as many groups and people as possible that are committed to building this space out, be part of this work. And to do that, we've got to train folks. We've got to help build an understanding of how community organizing works and how to build power within groups, particularly within healthcare. I think that you know, our experience has been with our community organizing program, when we hold our house meetings with physicians, like we do in Pennsylvania or any other states that we're in. One of the things that we learn is that we just, as physicians and healthcare providers, this is so foreign to us. Nobody teaches us how to tell our story. Nobody teaches us how to mobilize others. No one teaches us how to sort of do a power map, right? And so I think that we're helping to start that process. I'd like to see that 10x, right? I'd like to see the teaching of community organizing not just happen in these nonprofit groups like our group, but happen at medical school level and in residency. And there are some bright spots. There's a community organizing program here in Boston at the Cambridge Health Alliance. Shout out to them, who's been doing incredible work. By the way, taught by physicians who are community organizers. And so I think that's where the true power lies, not in getting people to do things for you or get them to use a tool that you've created, but train them such that they are better at the end of it. They are stronger, they are different, they can go out and continue the work in their own way. So that's the work that we hope to do after the election. And as Mark mentioned, you know, having the infrastructure and the funding to support that is by far the most important thing. And we've got some of that, which will last us until 2024, which is a great step, but we got to, you know, this work won't end in 2024, that's for sure. So.
Let me just, as somebody who was a community organizer, I think it's important, especially talking about this, is that you remember what a community organizer does. The community organizer doesn't go into the community and tell them what their problems are, right? It finds out what their problems are and they help empower them to solve their problems. So I think, you know, for example, what could, you know, the folks who want to help extend this work do, what I would do is after the election, is I would contact some of the organizations on the ground who tried to do this work and find out what help they needed they didn't get, right? What's missing from being able to do more of this, right? Community outreach workers, the ability to get materials on an ongoing basis, the ability to hold, the real power that physicians have, providers have, is that you're trusted by the folks in the community, right? If you talk about why voting matters, if you talk about calling your member of Congress and telling them you want, insulin paid for or whatever the situation is, it carries more weight than just somebody who drops into the community, right? And so I think thinking about where you go going forward, the question is, you've got this group of people and organizations that want to do this work. And, it is so big, you're not going to be able to go everywhere and do it everywhere all at once. So I would try to identify the places where you can make the biggest difference the fastest and build examples, right, of how this can be replicated in other places that are similar. Like what Alistair's doing in some hospitals, there should be outreach to other hospitals. But you're talking about a big hospital in Boston, not a rural hospital in, Eastman, Georgia. And I think that's really where I would like to see, it's not just a matter of resources. Yes, there needs to be more resources to pay for this work, but there needs to be some way to try to find out what's missing in the places that are trying to do this work and help them do it better on an ongoing basis, and then replicate that in as many places as you can. From a health center perspective, that's kind of what I see. Is I think I would love to see health centers, have more people, doing outreach at the health center, doing this kind of work, providing materials, that kind of thing. So I think that's where I would come down on that. Where you go on, where's a roadmap going forward? I think, don't start out with a map of the world, maybe start out with a map of a state instead.
Jonathan, I just wanted to add one point to what Alistair and Mark have said, which is just, it's also partnerships. It's beyond healthcare. It's beyond a physician-centric or healthcare-centric model. This is about, we need to partner with community and community organizations and others. So for example, I think medical legal partnerships, or there's a lot of law students and lawyers and others who are, I think, trying to address the more upstream and immediate issues around voter suppression and voter disenfranchisement, right? So that's a critical piece of this. There's also people who are trusted in the community, who understand the community, their needs, their desires, their concerns, and also what matters to them, and the way in which voting or civic engagement may or may not solve for that. And partnerships with that, so what are the ways that we can help contribute to that? Or what are the ways that we can share and learn together? So it's beyond, I think, there's sharing and learning amongst the health professional community doing this work, but it's also about partnerships outside of the healthcare community to look at the broader perspective of all the drivers towards civic engagement that we need to start looking, I think, more towards in the future.
One other thing I would just suggest, because I was thinking about the work that Katie does, and I actually, it never occurred to me, I'll be perfectly honest with you, about patients in hospitals who don't want to vote and can't vote. So I think one of the other real contributions that organizations like yours could make is whatever mechanisms are possible to disseminate this work, right, are going to be hugely helpful. I mean, no organization has the ability to reach everywhere. But if everybody were talking about the various elements of this and where it's being done and how it's being done, you would leverage your influence more widely. And I think even for the people who think they know what's going on, we don't know everything that's going on. And so I'm not sure how that works, but I do see that as a really valuable, part that all of you can bring to this, especially, the medical students and the younger folks.
Yeah, I agree with everything that everybody just said. And I think that kind of goes back to what Alistair was saying about just what is the role of a physician. And I think that is changing. And I think that in my medical education over the past couple of years, I've seen a lot of times when our teachers are trying to educate us about what our role is outside of just providing medical care. And that's really different from what a lot of our preceptors have learned and what they see as their role. And even among my classmates, who I think are pretty open-minded and educated about these non-medical things that they need to consider, there's a lot of questions of, okay, so if I'm supposed to, worry about their medical care, their medical conditions, and I also have to worry about their housing and their insurance status and whether or not they can access food, what is my role? How am I supposed to deal with all of this? And I think as Saranya was saying, it's that you need to know what connections to make. You need to know what resources are there, who you can send your patients to, and who you can ask for advice about these things, because you can't do it all. But I think just changing the way that we train physicians and other healthcare professionals to understand that these things are so important and there are resources out there. And I totally agree. As you were saying, Mark, just making sure that everybody knows that these are issues our patients face and that there are resources to help them.
Wonderful. And Mark, you provided a great little segue. We would love to have you all back after November at some point so that we can continue to build coalition, discuss, and learn about initiatives that we can amplify. I want to respect everyone's time. We're coming up on the hour. If our speakers have time, Zoraida asked a great question that we have not touched on quite yet. Could each organization just briefly go around and describe your plans past November?
I have to hop off for another call, so maybe I'll start things off here.
Perfect. We'll catch you next time.
Yep. So 2024 is our date that we have an infrastructure in place for in terms of all of these kits working, the posters working. So for everyone listening, please keep using your kits. Please keep using your posters. They will work, and this work does not stop on November 3rd. So please remember that we've got to help our patients vote like their health depends on it year round, not just when it's popular to do so. So thank you all very much.
I want to thank you very much, Alistair, for coming. We'll let you hop off, but we'll continue with the others.
Well, I would just say, community health vote is kind of a nebulous thing. It's really the National Association of Community Health Centers that kind of organizes this work now. I used to be there. I'm a consultant now, but my hope is to continue to work with health centers so that they do what they build on what they've done. The one thing I would say is the great work and the most important thing we did for health centers, certainly these days, was to make them comfortable doing this work. So NAC has really created some legal guidelines for folks and some best practices that health centers can use. The lawyers have vetted so that people know what the guidelines are for things they should and shouldn't do and how they can do them. And then I think, for the most part, we're going to do what we've always done, which is continue to reach out to do advocacy, to educate people and include voting and the need to vote in that whole process. So I don't see a lot changing from what we've done, except maybe now that there are so many more people working on this, maybe there's a lot more resources that health centers will have to be able to call on.
I can go quickly. So Vote Health 2020 is definitely continuing under a slight rebrand. I am not a tech person. I do not know how to do any of these things, and Vote Health was already taken, but Vote Health 2020 wasn't. So we went with it. Lesson learned. So we will be continuing under a slight rebrand, which we'll announce soon. But we are, we plan to go even harder post-November, take a little bit of a break, and then go even harder, because there's so many people who are deeply passionate about this, not just at a national level, but also really passionate about local and state issues. And so there's opportunities to help people at that level. There's also people who are wanting to run for office themselves. And this is, again, where partnerships are really important. There's a lot of organizations out there to support health professionals in becoming state and local and federal representatives. So there's a lot of different opportunities. It is an understanding of the commitment, the connection between civic engagement and health outcomes, and health professionals who want to see that operationalized deeply in their institutions, in their communities, at the state level and at the federal level.
Yeah, I'll just speak quickly about patient voting. So obviously our main activities are really focused around the week leading up to the election. But I think that Mark really hit the nail on the head when he said that, like, getting the word out that this is an issue and this is something that people need to know about if they're concerned about being hospitalized the next election, or just knowing that this is an option for them, and also supporting the other organizations that are here and others that exist with educating voters up until the next election, local elections, state elections. Yeah, so we're really excited to keep going.
Wonderful. Definitely. With that, I thank all of our speakers for your time. Our apologies going over a touch, but it was a vibrant discussion. Thank you to AMSA for providing this forum. We will be putting this up online and sharing it more broadly. Appreciate all your time.
Thanks.
Thank you so much.
Thank you.
Thank you.